Conduct disorder is defined as a pattern that is characterized by aggression, rule violation, or violation of the rights of others. The four behaviors that we see in patients with conduct disorder are aggression towards people or animals, property destruction, rule violation, and deceitfulness or theft. In order for a patient to meet criteria for the diagnosis of this disorder, they must present 3 out of 15 behaviors that are listed in the DSM-5, which is our diagnostic manual. And these behaviors should be present for a period of 12 months. But one of them should be present in the past 6 months. For example, aggression towards others. These patients can be described as bullies. They can use weapons to hurt other people. Like I said before, they can also exhibit some aggressive behaviors towards animals. They can be involved in stealing stuff or property destruction with the intent to damage the property. There are 3 subtypes for conduct disorder. The first one is childhood onset. That is when we start seeing symptoms before the age of 10. The patients that have this type of subtype of the disorder, they usually have a worse prognosis associated with it. Then we also have the adolescent type. That is when we start seeing symptoms after the age of 10. These patients have a better prognosis than the ones with childhood onset because they have a little bit more of a normal type of relationship with their peers. And then we have the unspecified onset. That is when we as clinicians don't have enough information to say if the symptoms started before or after the age of 10. So conduct disorder can have a huge negative impact in the lives of our patients. These kids can be involved in a lot of risky behaviors that can lead to complications down the line. For example, they can get in problems in school or in trouble in school, resulting in suspension or expulsion. They can also have legal problems, physical injuries, and then later in life they can have a lot more complications medically, including a higher risk for sexually transmitted diseases, unplanned pregnancies, or also down the line they have a higher risk to develop a substance use disorder. So the treatments available for conduct disorder include psychotherapy and pharmacotherapy. So the psychotherapy, there's different types. But the most important thing is that they not only involve the patient, they try to involve also the parents, the teachers. Now, regarding the medications that we can use, those are not the main component. The main component is going to be the psychotherapy, but we can use the medication to help us with some of the symptoms, such as the irritability or the aggression. Some of the medications that we can use include atypical antipsychotics, SSRIs, mood stabilizers, beta blockers. But like I said before, the medication is not the main component of the treatment. The psychotherapy is going to be the core component. The prognosis is going to be guarded in those patients that exhibit a higher severity or a higher number of symptoms. These patients can have a higher risk to develop mood disorders later in life, such as depression, anxiety, and they can also have a higher risk for substance use disorders. The best prognosis are going to be associated with those patients that don't have any other psychiatric disorders, learning disabilities, or those patients that have a good support system around them. So if they start seeing this pattern, like I said, if it's just one time, okay, like that is not a pattern. They need to start seeing a pattern where the kid displays aggression towards other people, they violate rules, or they violate the rights of other people.